Hey, welcome to UroPatient, where we help you to understand urologic health in clear, simple terms so you can make better decisions about your care. Hey, don't forget to help us out by liking and subscribing to our channel. If you're enjoying what you see, make sure you subscribe. Today, we're talking about a condition that many men and parents have questions about, but often feel uncomfortable discussing: phimosis. This happens when the foreskin cannot be pulled back over the head of the penis. While it can be normal in young boys, in adolescents and adults, it may cause discomfort, hygiene challenges, or even infections. In this episode, we'll explain why phimosis happens, the common symptoms to watch for, and the different treatment options from simple medications to minor procedures. I'm Vic Senese, and this is UroPatient, helping you take charge of your urologic health. So let's get started. Defining the barrier, phimosis is defined as the inability to retract the foreskin completely over the glands of the head of the penis. Just like a picture here shows a turtleneck sweater that can't comfortably be rolled down, that phimotic ring prevents the skin from gliding normally. While the condition is common and highly treatable, this constriction ring impairs normal function, making hygiene, urination, and sexual activity difficult or painful. Now, it can be confusing to know whether the foreskin tightness is normal or a medical problem. In infants and young boys, it's normal for the foreskin not to retract, and it often becomes gradually retractable during childhood or teenage years as the tissues naturally loosen. Now, this is called physiologic phimosis and usually does not cause pain, scarring, or problems with urination. Abnormal scarring, sometimes called pathologic phimosis, is different and may occur when the foreskin becomes white, thickened, or scarred and cannot retract due to conditions such as infections, inflammation, or skin disorders like lichen sclerosis. Signs that suggest a problem include pain, cracking of the skin, ballooning of the foreskin during urination, recurrent infections, or difficulty with hygiene. If these symptoms occur, it's important to see your healthcare provider who can evaluate whether the condition is normal development or true phimosis and discuss treatment options if needed. Now, you should seek medical advice if you notice symptoms suggesting that foreskin tightness may be causing problems. These include pain when trying to retract the foreskin, cracking or bleeding of the skin, swelling or redness, difficulty urinating, or more importantly, the foreskin kind of balloons out on you. Repeated infections of the foreskin or head of the penis are known as something called balanitis, and it's also a warning sign. Adults or older boys who suddenly cannot retract the foreskin after previously being able to do so should be evaluated. In rare cases, the foreskin can become trapped behind the head of the penis. Now, this is a painful emergency called paraphimosis. If you experience this, you need to see your healthcare provider right away. So let's talk a little bit about that balanitis. It's an inflammation of the head of the penis and often the foreskin, and it causes redness, swelling, itching, soreness, and sometimes a discharge or unpleasant odor under the foreskin. This condition commonly is related to poor hygiene, irritation from soaps or chemicals, yeast infections, or bacterial infections, and tends to occur more often in men who are uncircumcised because moisture can become trapped beneath the foreskin. In some cases, underlying health conditions such as diabetes can increase the risk of balanitis. Now, diabetes, just so you know, one of the side effects of diabetes is you're going to have high sugars in your urine. Bacteria just love to feed on sugar. You got that wet, sugary stuff underneath the foreskin, you're looking for trouble. Gentle daily washing with warm water, keeping the area dry, and avoiding harsh soaps can prevent irritation, but persistent symptoms should be evaluated by your healthcare provider. So again, we talk about paraphimosis. This is a medical emergency. It occurs when the foreskin gets pulled behind the head of the penis. Sometimes it's caused by somebody putting a catheter in you. They pull the head back, go to put the catheter in, and they forget to return it to its normal position. Now, when this happens, The foreskin forms a tight band that can block blood flow, causing swelling, severe pain, and a tight ring of skin behind the tip of the penis. Now, the head of the penis may become red, dark, swollen, and the swelling can worsen quickly if not treated. Paraphimosis can sometimes occur, as I said, after a medical treatment or a catheter placement. Always make sure that the head of the penis, if you're uncircumcised, that foreskin is retracted over the tip of your penis. It's dangerous when that's left that way. Now, this is somebody who otherwise could be normal, not other problems. So how do we take control of this? The medical treatment for phimosis often begins with non-surgical approaches, which is kind of good, especially when the condition is mild. Healthcare providers commonly prescribe a topical steroid cream that is applied to the tight ring of the foreskin for several weeks to help soften the skin and gradually allow it to stretch. Gentle daily retraction exercises, only as far as comfortable, may also be recommended. Good hygiene, washing, etc. help. And if you're diabetic, keeping the diabetes under control. Sometimes, if balanitis is present, antifungals or antibiotic medications are necessary. And as a last resort, surgical procedures like a dorsal slit where they just cut the foreskin and allow it to slip open, or completely removing it, which is called a circumcision. So, step 1, establish a baseline of gentle care and conservative care. That's the cleaning, regular washing, retracting the foreskin, putting it back over. Step 2, that doesn't work, then we look at medications like the steroids. We've had a lot of success with steroid creams helping to decrease that inflammation and helping to treat that. Sometimes even before we would do something like a circumcision, we would want to soften the skin to help reduce that inflammation. Then, step 3, manual gentle stretching. Talk to your doctor. They'll describe whether this is appropriate for you or not. Step 4, active or permanent resolution through surgical intervention. Sometimes there's no other choice. You have to do either a circumcision or some of these other things called frenuloplasties or prepuplasties, or again, just a dorsal slit. All of these things are good treatments for this problem. Now, many patients feel anxious about surgery for phimosis, and the most common fear involves pain, changes in sexual sensation, recovery time, and concerns about appearance. Procedures such as circumcision are typically performed with local or regional anesthesia, which means the area is numb during the procedure, and most patients report only mild discomfort during recovery, and that can be managed with simple pain medications. Tylenol is my go-to for patients. Some people worry that surgery will affect sexual function, but for most men, normal sexual function returns after healing, usually within a few weeks. Others are concerned about cosmetic outcome or the idea of surgery itself, but these procedures are very common and generally safe when performed by an experienced healthcare provider. So bottom line is, we don't recommend the circumcision as a preventative, but when you've got this issue, it's definitely the best way to sometimes treat it. Now, for many men with problems related to phimosis or recurrent infections such as balanitis, treatment including circumcision can significantly improve comfort and sexual health. When the tight foreskin inflammation or pain is resolved, many patients find sexual activity becomes more comfortable and less stressful, which can help restore confidence and normal sexual function. In cases where discomfort or anxiety about the condition has interfered with erections, relieving the underlying problem may also improve sexual function. So while individuals' experience may vary, we can kind of see that from this report up here, we went from 59.4 to 1.4% by treatment. So be sure to reclaim your confidence, restore your genital self-image. You've got nothing to lose. Best path is to take the path of lasting relief. So again, in summary, foreskin issues like phimosis can range from normal development, tightness in children, to conditions that require medical attention, such as scarring, infections, or emergencies like paraphimosis. Signs that you should seek help include pain, swelling, difficulty urinating, recurrent infections, or inability to retract the foreskin after previously being able to. Non-surgical treatments like topical steroids, gentle stretching, and poor hygiene are often effective, while surgery, including circumcision, may be recommended for severe or recurring cases. These treatments not only relieve symptoms, but also improve comfort, prevent future infections, and restore normal sexual health and function. Always consult a healthcare provider for evaluation and personalized guidance if you have concerns about foreskin tightness or related symptoms. So there we go. Everything you wanted to know about phimosis. So again, it's something that I've seen a number of patients come in as an emergent reason. The sooner you get in, the better. There are techniques and things that we can do sometimes in the office to quickly reduce it and get you out of discomfort. But if you get that paraphimosis, the foreskin stuck behind the head of your penis, and it goes for a long time, it's surgery, the only way to relieve it. And not the most fun, because you're sitting around waiting for us to get you into surgery. So anyway, take our advice, always take and check that and let us know if there's a problem. Tune in next week for more on UroPatient.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see. Podcast is here.